Hi, this is Shelby from Turn Sounds. Go buy yourself a new pair of socks.
Hey, I'm Abbey, a clinical nutritionist.
And I'm Shelby, a clinical exercise physiologist, and this is the Move Your Mind podcast.
We are sick and tired of people being led astray by false information about diet and exercise.
So join us as we discuss common misconceptions about food and fitness with the latest scientific research.
Let's get into it.
Hello!
Oh, we're starting?
Yeah!
Okay, we're going.
Welcome back, Renee!
Thank you.
Thanks for joining us. Of course. It's good to have you. I think we just figured out it was about 4 months since you were on. So it's good to have you back. Chat things, pregnancy, and...
Went very quickly.
I know.
It did, didn't it?
It's good.
Well, Shelby got a little bun in her oven that's about to come out in that time.
I opened the door for Renee and she's like, "Why? You look pregnant."
Yeah, actually looks like there's a baby in there.
Yeah, there is. I got a flying side kick to the ribs this morning. I just got to work, minding my own business, and whack.
Oh.
All right, that's what we're doing. No worries.
Ouch.
Has it
right.
sunk in yet that there is a baby?
Oh, absolutely. Yeah. You can't ignore the feels.
Shelby's been like that since like week 5 when you found out. You were like,
there
I
is a
feel
baby.
different.
You do look different.
Yeah.
Pregnancy glow. I always doubted it, but I think you
No,
do.
Shelby has it.
Yeah,
I did a workout
100%.
today, so I am feeling pretty great.
Oh.
The first one, like 2 weeks. So I'm feeling like I've got my stuff together today.
Shelby is what I want to be like when I'm pregnant. I'm like, this is what you think about. But then, you know, having clients that are pregnant, they're like, what is this glow? Like, someone give it to me. I
No,
feel
I
like
love
crap.
it. Oh, I'm loving it.
Are you one of those people that loves being pregnant?
Loving it.
Yeah.
Yeah, absolutely loving it.
And then those people that are going to hate you.
Yes.
Well, lots of the people who like hated pregnancy are like, oh, but I have a really nice baby. And then they try and say, if you have a really good pregnancy, your baby kind of sucks the first few months.
It's only fair.
So they're trying to throw it back at
Surely.
me since you had such a good time these last 9 months.
Having a child's going to suck. It's like that movie, you know, when that, what is it? What to expect when you're expecting?
Yeah.
Is that it? When there's that blonde girl that just sneezes and her baby pops out, and then there's this other girl
That's
that's
what
like
I keep
in
joking.
labour for 42 hours.
I keep joking with my clients. I'm just going to be like, achoo, oh!
Oh, fingers crossed. Wouldn't that be nice?
If that happens, I'm going to put the baby back in and make you go. It's
Make
not
me
fair.
work for it.
You trained so hard, Shelby, for this. Anyways, shall we discuss what we're meant to discuss?
Sure. So we do a follow-on from my last episode talking about pregnancy stuff. For a little bit more of the specifics, I wanted to get Renee in. And so, yeah, have a bit of a chat, mostly about, I think, kind of gestational diabetes, lying on your back when you're pregnancy, pelvic pain, the goodies, the good bits.
Sounds good.
So, yeah, wherever you want to kick off. What do you want to start with?
Shall we start with gestational diabetes?
Perfect, because then the other two kind of flow in a bit better.
Yeah.
Yep, do it.
Sounds like a plan.
What do we want to know?
Well, we know that gestational diabetes is a type of insulin resistance that comes on during pregnancy.
Yep.
I know it puts you at a greater risk of developing type 2 diabetes later in life. So it's pretty good to prevent if we can. And then I got screened at 27 weeks for
Yes,
gestational
everyone
diabetes.
gets screened for
Yep,
it.
yep.
Apparently it's very awful. You have to drink an awful drink.
Yeah, so you have to fast overnight. It was the first day of lockdown. I had to go in, so we had
I remember
masks.
that.
And so I had fasted. We had to wear a mask. You have to drink this sugary drink after a blood test. And I was sitting in the reception, and I just went clammy and pale, and it was like,
yuck.
went to vomit. But if you throw it up, you have to start again. So
Yeah.
you're like,
Is it that
hold
bad
it
that it
in.
made you want to vomit?
It was, I think, more just like the changes, like the fasting into the really, it wasn't really sweet. The drink was fine, but like into the massive spike, into a warm receptionist room with a mask on.
Yeah, that's not
I think it was just a bit. So I like stripped my shoes and socks off and had my like bare feet on the tiles, like breathing through, going, I can't get this up. Like this has to stay down. And the receptionist was like, "Are you okay?" I'm like, I just need, I don't know. So I went and lay down and it felt better. And then, blood test an hour after that, and then another blood test an hour after that.
Because ultimately it tests how well you respond to drinking like the glucose, which is a sugary drink.
Absolutely.
So they test your insulin response, whether or not the insulin response to the glucose uptakes it like it should.
Yep.
And if it doesn't, gestational diabetes.
Yep.
Well, to a certain degree.
My levels never went above like 6 millimoles. Like
Oh,
It was
wow.
really,
That's really good.
yeah. So I was like, I know how to use my glucose.
Yeah.
I'm good.
Well done, Shelby.
Thank
Good
you. But anyway, yeah, it's a bit of a funny test. And then I was leaving and I got, just realised what podcast I'm on. I got a Whopper and a milkshake and came home and ate it and I napped.
job. You deserved it.
Oh, your poor body.
It was hectic, yeah.
You just drank all that sugar and then you go get a thick
But
shake.
you feel like nothing else. Like I just wanted calories and I had no brain left to think of anything better. I was like, it was like 11 o'clock in the morning. It was great.
Wow.
Sorry.
No, I'm just thinking, well, that just supports everything we talk about, right? Like not eating enough and then going for calorically dense foods as a result
Absolutely.
of not
And like
nourishing
having
yourself.
no brain power left to make any other decision. I
Yeah.
was like, this is what I'm doing.
Yeah, makes sense.
And then I was tired.
I'm not mad, I'm just disappointed. No, I'm kidding.
Anyway, then I remembered I have to do this with every kid I have. I have to go through this test.
Fun.
Yeah, something to
That's
look
Shelby
forward to.
rant time over.
Yeah, so the question wasn't it? Back on track. I just feel like
I
I'm
don't
reeling
have
us in
gestational
today.
diabetes.
Yeah.
Also, we never even came to that. Anyway,
So it's like exercise's role in potentially decreasing the risk or managing it?
Yeah,
if
pretty
you
much.
have
What's
it?
the role of exercise?
with gestational.
Yeah, around
diabetes.
gestational diabetes.
Yeah, well, I guess first things first is gestational diabetes is not a contraindication to exercise.
Yeah.
So that's the biggest thing. So you can still exercise even if you get diagnosed with gestational diabetes.
Which is what I thought.
Yeah. In terms of good evidence, there is good evidence to support that regular exercise reduces your risk of getting gestational diabetes.
As in like type 2 diabetes and stuff.
Yes.
Right?
Yeah.
Yeah, probably the same line. It would improve your glucose control to reduce your risk.
Just focus it like a little bit closer to you.
Like
This bit.
The mic.
pull it. Oh, it just extended.
Yeah, it rotates. Okay. Thank you.
Is that better?
Perfect. Yeah.
Okay.
Less echoey.
Yeah.
Cool. Yeah. So kind of like with type 2 diabetes, as we were saying,
Yeah.
has a potential role in preventing it coming on.
Yes.
Mm-hmm.
Yeah, but the research to support exercise during gestational diabetes is a little bit less clear. So there's not great evidence to show that it actually has any benefit over the normal benefits for someone without gestational diabetes.
Thank you for saying that last bit because I was like, I still need you to exercise if you have gestational diabetes.
Yes. Yeah, so you should
Yeah.
still exercise, but it's not going to give you any further benefits than of a healthy normal pregnancy. There is some low-level evidence to show that it could help blood
You got this. Come on.
blood glucose levels after exercise, but in terms of everything else, yeah, not great evidence, which is interesting because I think most people would have thought the opposite.
I would have thought like
Yeah.
crazy better glucose control and things like that. So then just from a management point of view, we're just looking at controlling those levels across the board
Yeah.
and just not having hyperglycemia
Yes.
occurring.
Yeah.
And like nutritional perspective, making sure you're fueling adequately. Maybe, well, of course, if you were diagnosed with gestational diabetes, you'd be likely referred to a dietitian or nutritionist to kind of make sure you don't go into hypo
Yeah.
or hyper.
A client of mine had it and it was just like a group education session
Oh, okay.
where they told people, and half the mums were like, I'm not going to do that. I'm not going to
Oh, wow.
not eat fast food, or I'm not going to.
Oh, wow.
Yeah.
Because I guess if then, you know, and this is good evidence, this is systematic review showing that there's not a benefit from it, whether then there is an increased role of nutrition in managing it, which I would
Oh,
say
for
there
sure.
is.
Yeah, which we didn't
So-
really think to look at because I thought there would be a bigger role for
Yeah.
exercise. So I was
Yeah,
like,
so
cool,
true.
just cover the exercise component. So I absolutely think nutrition and just like education.
Yeah, probably has the biggest role
Yeah.
in changing outcomes.
Yeah, most definitely.
Yep. So go see Abbey then. Don't see me. Go see Abbey.
Yeah, don't see me.
If you want, like,
It's all you, Abby.
You
I'll
got
take
this,
it. I'll
girl.
take it. So yeah, exercise in summary, like it's not going to give you additional benefits, but it's also not a risk because it's not contraindicated. Like if you want to get benefit from dietary or lifestyle things, if you are diagnosed with gestational diabetes, dietary intervention is going to have more bang for your buck than exercise.
And then
If you're already diagnosed.
yeah, and then kind of like with a few other things anyway, you supplement that with exercise, and it's even better
Yeah.
than not exercising.
Yeah. Yeah, interesting.
There you go.
It's like, I'm just thinking, like, why? Because once you have type 2 diabetes, exercise has additional benefit.
Well, this is what I was wondering, if the time frame is just too short, right? So, like, if you're only diagnosed at 28 weeks, you have, like,
It's not a lot
3
of
months
time, is
left.
it?
Yeah, and exercise is a longer-term change. So if you only have 3 months to implement changes, you might not see anything happen.
Yeah, they'll be like, it's not going to provide a benefit because they don't see enough change in the blood glucose levels. That'd be interesting to look up, like, studies on type 2 diabetes and exercise and blood glucose control, how long they go for. So with that basis, would be thinking they would be longer than 3 months.
Yeah.
Yeah, and I think one of the other things they said as well is that there was such a variation in exercise interventions. So there wasn't much of a control, which is why the evidence wasn't too strong, which is also strange to me because I thought, the recommendations for exercise in pregnancy are pretty standard.
Yeah, well, it's just, I guess that's it. It's just guidelines,
Yeah.
like as in normal guidelines. So you can have quite a bit of variation within those guidelines.
Yeah, and usually if it was type 2 diabetes, it'd be a bit more controlled, like the role of high intensity
Like they're
interval
looking at HIIT at the
training
moment and things like that, yeah.
Or maybe they just haven't put... How many studies were in the review?
11, I think.
Oh, that's not too many.
Yeah, that's not
No.
much, is
Yeah.
it?
No.
Cool. But also maybe pointing to, like, it's not that big an issue to deal with if it hasn't been crazy researched. Like, it's not a contraindication. From what we've seen so far, it's kind of like, it's not a risk. It's not a crazy benefit. So just leave it. You probably wouldn't look too much into it from there.
Yeah.
And looking at, like, population affected by it, it's not as much as, like, say, type 2 diabetes, which would get all the funding for research.
For sure.
You know?
It's probably definitely less prevalent, like, of an issue, gestational diabetes over type 2.
I did look at some of the stats, but I decided not to include them in the
But
podcast.
in summary, definitely don't want any listeners with gestational diabetes going, oh, look, it's not going to give me any additional benefit. I'm not going to exercise.
No, because
That's
it's
not the takeaway.
just as much benefit as a normal pregnancy.
Exactly.
Yeah, which is lots of benefit.
Yes.
Yeah, which we covered some of last episode.
Yes,
So don't take this as don't exercise.
No,
Yeah.
just you
Please,
don't,
this is not a green card.
you're no different to someone without gestational diabetes from that perspective. Cool.
Yeah, and we gave lots of reasons why exercise is beneficial whilst you're pregnant.
Yeah.
In 2 episodes ago from now.
Yeah.
It would have been.
That's cool. Love
Answers
it.
that, hey.
Keep exercising. Nice.
Definitely. What's next? What we'll have in a chat before we started
Supine, so lying on
recording.
your back during pregnancy. Wanted to get a little bit more into the nitty-gritty. What I understand is the guideline is from 16 weeks pregnant. Don't exercise on your back. It's called a supine position. And then everything else I've received education-wise is from 28 weeks. Don't sleep on your back. Don't go to sleep on your back.
Yes.
So that's what I wanted to bring up with you and see where you're at. Because if you remember, Renee is studying pelvic health. What's it called?
Pelvic health.
Pelvic health, yeah.
Yeah.
Keep wanting to say women's health, but I'm like, no, it's
Used to be women's health, but
pelvic health.
we're being more inclusive now. Men and children too.
Well done, as you should.
Yeah, which we discussed in the episode you were on last time because I was like, men have a pelvic floor? I was like, I didn't even know that.
Mind blown.
So that makes a lot of sense that it's pelvic health, not women's health.
Yeah. And then Abby and I were debating whether you needed symptoms. So what we're talking about is if a pregnant woman lies on her back, then there's more pressure on one of the veins returning back into your heart,
Yep.
which can decrease blood flow,
Yep.
which can make you dizzy and feel sick and nauseous. And then the follow-on worry from that is that baby gets less blood flow. So there's a
oxygen.
decrease in
Yeah.
uterine blood flow. And then what we were wondering is whether you needed to be symptomatic for baby to be affected.
Yeah.
So we have clients where I'm pretty much on the side of like avoid it as much as possible. Like I'm pretty happy to keep them off
Yeah.
because mostly I see my pregnant ladies in group classes. So it's easier just to like,
And you're in an upright like gym setting, and then
Yes.
I come from a mat Pilates background
Yeah.
where you do lie on your back for a lot of the class. So
because
I'm
if I have
oh,
them in a gym, no worries. Like I've got
so
1,000
many
other things I can do. And then in Pilates, I usually just go, no, get off your back.
Oh, I have so much to say about this. My brain.
Brilliant.
is
Good.
ticking.
Brilliant. Good.
So you explained that really, really well.
Thank you.
And first of all, I don't think that you have to be symptomatic. because by the time, well, this is how I think about it, by the time you get symptomatic, that means you've got decreased blood flow. So it's almost, I think, too little too late, right? So if you're starting to feel dizzy, that means the blood flow has decreased. So, you know, I don't think it's worth the risk. You're better off not going on your back and not getting symptoms and knowing that you're fine, rather than pushing it and being like, oh, there are the symptoms and I've fainted.
And that's where I get to as well. I'm just like, the reward for exercises on your back is just not there for me to risk any of it. Because, I had a point that I have forgotten.
I do.
Because go for it then.
Renee.
And
Yeah,
then
what's your understanding of like the time? Is yours 16 weeks onwards, 28 weeks onwards?
Yeah,
what's
what do you-
your,
yeah, go
I
understanding?
normally say after the first trimester. So again, it is
Really?
hard because with exercise in pregnancy, there are multiple guidelines. So you've got the Canadian guidelines, you've got the Australian guidelines, you've got the ARCOG guidelines. Like there's so many, and they all say something a little bit different. But I always go with probably a little bit more caution and just say after the first trimester, because that's an easy time point.
Yeah.
Everyone kind of knows when that's going to be.
Cool. So then that's 12 weeks into pregnancy.
Gee,
Yeah.
wow.
Far out, it's a long... I mean, I didn't really do too much, I think. But yeah, fair.
And I think as well, it's just such an easy modification to make. And maybe I say this as someone who has been doing it for years, but it's not, you don't have to prop someone up very much. It's something like 30 degrees.
I read 15 today.
It's not much
15
at all.
degrees incline to be propped up from flat to
Oh,
just
wow.
avoid it all anyway.
So you could almost do all of your supine exercises in Pilates. You just need to put something underneath their shoulders.
Yeah,
So it's not a huge compromise to make for safety.
Okay.
Under shoulders, so that just affects like thoracic. Does it need to come from the pelvis? I thought that would have been like pelvic incline.
Well, if you put something underneath your shoulders, then it will.
You can't, it just wouldn't curl you up from,
If you
The
keep
ribs?
keeping a neutral spine, surely.
but can you keep a neutral spine while there'd be a big gap there?
Depends on level of abdominal strength, right? So you don't go into flexion.
Well, I guess the ideal is like you don't put something underneath someone's head, because that's just
Yeah.
going to put their neck
Yeah.
into flexion. When I was teaching Pilates, we used to use like a wedge,
Yeah.
which
Yeah,
is
okay.
the best kind of thing to use.
The wedges were huge. They were way more than 15 degrees.
Yeah.
Yeah. Because then I found tabletop quite hard to position on a wedge
Yes.
for my clients. I never had to do it pregnant. But then the strain, the work on the abs, I found was crazy high on
Yes.
the wedge.
Because you're
Yeah.
putting yourself into more hip flexion.
Yes.
Yeah.
And then again, tabletop is something that's quite difficult to do during pregnancy anyway. And that might actually be another thing we can talk about is diastasis, so tummy muscle
Yes.
separation.
Thank you. Thank you. Of
Yeah,
course.
sure.
As if we were going to scoot through these episodes
no.
without mentioning that. Thank you. Brilliant. All right. Well, yeah, happy to go. Oh, sorry. Does that apply then for sleep as well? When do you recommend clients not sleep on their back?
That's also a good question.
Yeah.
I haven't read anything that is different from exercise to sleep, but it could exist. So I'm not too sure.
I read something today. It wasn't. I don't know if you know Girls Gone Strong. What do you think
Yes,
of that?
yes.
And so this was what I was reading from them, and they said something about the decrease in uterine blood flow, so how much baby gets, is the decrease is less during exercise than at rest.
Okay.
So it was more of an issue at rest
Yeah.
than at exercise.
Oh,
And I
okay.
figured that was because like things were being kind of
Increased
like
cardiac output.
yeah, and like just diverted anyway during exercise,
Mm.
so you've got like less of a chance. But so, yeah, interesting.
But if you'd then say that recommendation
Would
should
be
be you
earlier.
shouldn't sleep on your back from first trimester onwards too,
Yeah,
right?
because everything I've been told and then has come up from what I've seen is 28 weeks is like the spot
That's
on,
a huge difference.
and then you just don't go to sleep on your back. If you wake up on your back, don't panic, just go onto your side.
Yeah, because it's very hard to control
Absolutely.
the way that you're sleeping
Yeah.
when you're asleep.
Exactly. And then they seem to think that position you go to sleep in, you spend the most time in that position anyway. So if you wake up on your back, chances are you haven't been there for long.
Yeah, exactly. And there's ways you can get around it. You can put pillows in certain places
or have a husband next to you that like pokes you awake every time he finds you on your back. Roll over. Okay.
Oh, that's cute. Because I was going to ask, like exercise on your back being an issue now that we've clarified even earlier on. So I was going to be like, oh, well, but if in a Pilates class you're only on your back for 10 minutes, is that seen as less?
Also a good question.
Yeah.
So from memory, I think the guidelines say anything over 10 minutes.
Oh,
So
okay.
10 minutes is kind of the magic number that is reported a lot, as anything over 10 minutes is an issue.
Okay.
Yeah.
So you could potentially be on your back for under 10 minutes and it be deemed as safe. And I guess that would just be before symptom threshold.
Exactly. So
Yeah.
if you felt gross at 3 minutes, just don't ever lie on your back.
Yeah.
But you're saying like the wedge or something, that's just such an easy modification to apply if you are a teacher like
Well,
myself.
I don't have, like in my gym, we don't have anything like that because I've had a few pregnant ladies. So that's probably also playing into my decision in my Pilates classes to just not do it
Because
at
of
all
the equipment.
because I don't
have.
really have anything I've come up with that could substitute because I don't have.
Yeah. I mean,
anything
you
like
can be
that.
pretty inventive. if
I'm
you
thinking
try.
now, like if I just
Yeah.
like folded a few mats up or something,
Yeah.
Yeah,
I think
I'm
Matt-
sure
that
I
was-
could have. But to me, I always had other things ready to go that.
What we used
Yeah.
to
I
do
didn't think
in
about it.
Reformer, actually, and I thought I was pretty smart for figuring this out. So the jump boards,
Yeah.
what we used to do is put them upside down, so the leg parts were pointing up,
Yeah.
and then they'd be flat against the shoulder rests,
Yeah.
and then you'd lay on it and it would make like a perfect angle.
Beautiful. Well done.
Whoa.
So you can be very
Well done.
innovative if
Well
you need
done.
to be.
I just wasn't. I went, screw it, I'll do something else. 4-point side lying, standing,
Yeah, there's
anything
so
else.
much that you can do.
And then,
Definitely.
yeah, exactly. And then any other time I'm in the gym with them. And so I wouldn't do anything. Yeah, cool. Nice. All right, so ab separation. Go for it.
Have you talked about this much
Don't
before?
think so. I think I might have mentioned it
No, I
slightly.
think we talked about, because I want to ask a question as well about like flexion, because there's guidelines around like abdominal curl.
I knew this is why I was like, let's wait for
I'm
Renee.
such a nerd for this
I
stuff.
love
I
it.
get so excited.
That's
No.
exactly why I waited.
Yes.
If you're not watching, Renee just like shivered with joy.
I love it.
Anyway,
So happy to be in a room of fellow nerds that get excited over abdominal curls. Like guidelines about, you hear in Pilates training, like after usually first trimester, avoid abdominal curls, flexion, thoracic flexion.
I've even heard it go a step back and go avoid ab training.
Ugh.
I know,
Ugh.
which makes me go no.
No.
Cool.
Yeah, because of the risk of like downwards pressure, abdominal separation. So I wanted to get your clarification on that, because I'd certainly heard a few things, different things.
So first things first, abdominal separation can be called a million different things. Rectus abdominis diastasis, diastasis recti. Have we heard any other ones? Dram
Split
sometimes.
abdominal. Sometimes it sounds really crazy.
Yeah, so there's quite a few words, but essentially what it is you've got your six-pack muscles, so
I'll
your...
put a photo up when I edit it.
that would be good. Your rectus muscle, I guess, so your six-pack muscle, and it has two sides. So when you are pregnant and your belly is growing, naturally the muscles have to stretch to allow your belly to get bigger, and then what happens is between the two sides of the muscle there is a gap. But this is perfectly normal. I think something actually is probably every single person who has
That's
ever
the
had a
last
baby
I
has a
heard.
degree
Yeah.
Yeah.
of tummy muscle separation. It may be small, and now they're saying anything under 1 centimetre or even 2 centimetres now, I think, is normal.
Yeah. Well, yeah, like
You couldn't keep
where's
the
it going to
same-
go? You can't.
No,
Yeah.
something has to move.
Absolutely. Like all your organs get squished up out of place. Like your muscles can just go a little bit.
Yeah,
Yeah.
sure.
Yeah.
Like, I'm pretty sure I have a 1 centimetre separation, and I've not
Just
had a
from
baby.
being a person.
Yeah. So I'm sure we've all seen pictures of those women who have a very prominent like line down the middle of their stomach,
Yeah.
and
They
that
fit their fingers in
Yeah.
there.
Yeah. 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 Or it like domes. So if they're pregnant and they're like using abdominals, it can like dome, or we call it tenting or whatever, and you get this like teepee kind of thing down the middle.
Tenting, coning sometimes
that's
people
weird.
call it.
Yeah, fair.
Yeah.
And then after, I've definitely had women postpartum, and you can just like fit a few fingers in there.
Yeah.
Abs.
Yeah. So in terms of exercise, again, separation is not a contraindication. And you can still train abdominals, first of all, when you're pregnant, and even if you have tummy muscle separation. The biggest thing is, first of all, probably seeing a physiotherapist is quite important. I wouldn't recommend just kind of doing it yourself and winging it. So if you do notice it, it's better to get onto it quicker so that your recovery after you have a baby is better. And then the other thing is that what you want to watch out for is exercises that cause that doming or coning or tenting or whatever you want to call it. And those are the exercises that are probably not contraindicated, it's probably too big of a word, but not recommended for you. So you can do any abdominal exercise as long as you can control it. So flexion, sit-ups is fine if you can do it with the control not to dome.
Nice. Because otherwise you're just putting extra pressure on that, and we don't really want it to separate. It just is going to. So we're going to minimize the damage.
Is that through like all trimesters?
Yep, through all trimesters.
Yeah, wow. Okay,
And
so that's new.
Mine
Yes,
only happens
yes.
when I'm silly and like I'm sitting on the bed and like lean back to put my pants on or whatever, and it goes boop.
Yeah.
Most
Oh,
people
hi.
say that when they notice it, it's usually when they're doing something like a daily task that they wouldn't think about. So getting out of bed is a huge one. Like when you sit straight up and you do that kind of big crunching movement.
Yeah.
But yeah, Abby, like you said, it is different. I think even I'm probably guilty of a couple of years ago telling people no sit-ups after like the first trimester. It's just
Well, like the overlap of that, does a sit-up count as a supine exercise? Or no, because you're coming up regularly enough?
good point. I think you'd probably have to, it depends how long you were doing this sit-up, I guess.
Yeah.
But you'd probably want to start the sit-up from more flexion.
Of course.
Anyway, from a diastasis perspective, it's going to make it easier because you're shortening the lever. So if you want to modify for someone who has a diastasis, make sure that they've got the control, make it easier, prop them up a bit so they don't have to go through so much range.
Yeah, nice. It doesn't hurt or anything, the separation. It just looks funny, and it feels quite like not controlled. It feels like, when you just like brace by pushing your belly out. It just feels like that. Like it's not a nice controlled movement, I've found anyway, when I'm doing it. Because I've found, and maybe this ties in, you can help us. If I know my client has a pretty nice awareness of pelvic floor, if I see them doming and I cue pelvic floor, it can usually ease the doming.
Usually that is because pelvic floor and your deep abdominals, so your transverse abdominis, work together really well. So if you're lifting your pelvic floor often, you will also activate through your TA or transverse abdominis, and then that will give you the control to not dome.
And that's just because less stress on the superficial muscles?
Yes. Yeah. So you're controlling that movement with your deep muscles rather than... Yeah.
This was something I heard on a podcast. Transverse abdominis, the fibers go horizontally.
Yep, so they wrap around like a corset or...
Yes, still into like linear elbow though, right? Like, So if they contract, are they not pulling the middle more apart?
Oh,
this is a lot. My brain.
simple answer, no.
Cool.
There's this really cool paper that I remember reading for uni where it had pictures taken, I think, on ultrasound or something, where they've kind of explained like what you're doing, but no, that's all I remember. Is I can't. It's very complicated.
That's fine.
I don't think I can articulate it, but no.
How many times on this podcast have I ever been like, I don't really know the finer details. I just know the end answer, and it's no. It's fine.
Stress less.
Because you get into like crazy biomechanics then, and makes make your head spin a little.
It is very interesting.
But
I should
it's
find that
okay.
paper.
Because, yeah, that's a common thing I hear as well. Like, only train pelvic floor in TA, which is fine.
In pregnancy?
Yeah. But
Yeah.
you can still train that flexion movement as long as it's controlled.
Yeah, you can train all.
Well,
all-
yeah,
all
absolutely.
abdominal
Yeah, I think
movements, so
flexion
obliques,
just kind of
everything.
gets the bad
as
rap.
long as you can control it. But I guess that's very similar to any other type of exercise, right? You're not going to go and tell someone to do an exercise that they can't do with good technique.
Yeah, absolutely. Yeah.
so true.
And then what I've been training very like neutral anyway, because when you have like a baby to prop up on your hip and you or whatever, like I want to be able to hold myself nice and square anyway. So a lot of my training has been like suitcase carries or pile off press or whatever, where I can keep everything like
That's so functional. I love it.
Isn't it?
Anti-rotational movement.
all the anti exercises
Yeah.
I've been doing a lot of.
Mm.
I don't like the feeling of extension. I hate the feeling of stretching my belly, so I've not been doing any of that. And yeah, I don't really train
Lateral.
anyway, I guess. Cool.
I was going to ask, like, another guideline that I hear is when you're doing, like, C-curve, so sitting on your bottom, like, scooping through your belly, getting, like, a C-curve shape.
Yeah.
You know
So
the
from
exercise I'm talking
upright
about?
and then you kind of roll back.
Yeah, so
Like
imagine
a half roll down.
Yeah.
Yeah, imagine sitting up tall with your knees bent, hands behind your thighs, and then scooping like someone's punched you in the stomach in little quotations. We're told, or I've been told, to encourage pregnant ladies to keep a neutral spine instead of creating deflection. Yeah, and I'm like, does that come from the mentality of don't train through flexion because you're more likely to get the doming? Because that's just
I'm
like,
trying to think of what
why? Me too now.
the rationale behind that would be, because I think personally, if you're getting someone to do that with a straight back, it's more rectus than it would be with a curved spine. And I think you'd be probably doing more of like a Valsalva, like a
Yeah, which
Agreed.
is definitely something we want to avoid.
yeah.
Because I've most certainly read that in manuals.
Yeah,
Like,
interesting. Yeah. So you've come from a Pilates training background only.
yes,
Yeah.
this is where the
Yeah.
majority of my knowledge is
Could
coming
it be
from.
because of the compression of the belly as you see curve, maybe? Like they just don't have the ability to do that because their stomach gets in the way.
Yeah, true.
Yeah. Shelby right now is flexing, getting herself into a C-curve
You
shape.
can't you can't get that lift up and in feeling because there's a baby in the
Yeah, so maybe like the
But I
range of
hate that
motion is reduced because of the belly being there. So it's like you're going to get more of an abdominal workout if you keep neutral spine because you can get more of the range to challenge rather than having to stop because there's a basketball in the way.
Yeah.
Maybe that's why like the effectiveness of the exercise, not the contraindication of the exercise.
Yeah, but I would say a lot of pregnant people would struggle with that. It's
Yeah.
even non-pregnant people struggle with that.
Absolutely.
So it would be a lot of load on their abdominals.
Yeah.
So it's just same as anything. Individual,
Yeah.
if you can
Pull
handle it,
behind
go
the
for
lower
it.
back to help if you need to,
But again, if I have to work that hard for an exercise, I'm moving on to
tabletop.
something else.
Come
Yeah.
up and over
Yeah.
4-point
So
kneeling.
many other
reach the
things.
opposite arm and leg
I'm
lock.
just not going to work that hard to get a client into an exercise. Just never.
Oh, yeah, I feel that.
So, yeah, that's fair.
Yeah, wow.
Cool.
Can't wait
Yeah,
to
it's
pass
good.
this on to the girls.
And then another thing Abby mentioned, which I had never really thought of, is just lying on your tummy. And I just looked at it from like a common sense, like one, mentally it felt weird to lie on my belly early days. And then after that, there's a belly in the way. So I just wouldn't lie on my tummy.
Yeah, I think that
Yeah,
logic
cool.
makes sense.
Yeah, cool. Nice.
So if I have a client that feels comfortable lying on their tummy,
I think that should be fine,
Yeah.
but given that it's probably, I don't think that they will feel comfortable
Yeah.
doing that past like the first trimester.
Yeah.
to be
I had
honest.
a lady,
Yeah.
she was on the larger side anyway. But I'm pretty sure she got to like 18 weeks and she still loved the feeling of like prone, lying on your belly and then like stretching up into
Extension.
like a cobra. And I got like 8 weeks in and I hated stretching my belly. So,
Yeah.
yeah.
Yeah, I would say I probably wouldn't recommend it
I wouldn't either.
past, like the
because you can
first
work
trimester.
the
'cause
same
it just-
muscles anyways in a different position. That's very
Exactly,
easy to
yeah.
get into. Go on your knees, hinge from the hips. You're not on your belly.
cat cow, like if you want extension, then go for it.
Yeah.
Yeah, cool. That's brilliant. That sounds good. So about exercise, that's
Covered. What else do we want to talk about?
pelvic stuff.
Oh,
yes.
yes. I was like, there's
All the
something big that we're
goodies.
missing.
Because this was interesting. Renee already has debriefed us a little on some of this, and it made us go,
That's why we need to press record when we have our deep
I
chats
know.
before we get
My husband
going.
was in the room setting up the cameras, and he was like, "Are you recording this? This is great." I'm like, oh, we should.
Damn it, what did we say?
So watch out, listeners. The format's going to change. It's going to get real casual from
Yeah.
now on. It's just going to plop down. Hey, Abby, how's your day? And we have our little talk first, which you might have to censor. Sometimes we say things pre-recording that we're like, "Oh, we should not be recording."
Language control.
Anyway.
Sure.
Pelvic pain during pregnancy, very common as well. I've heard it be called lots of different names and different things being blamed. What's your kind of take on
So
what happens and when and why?
I call it pelvic girdle pain, and I think that's probably what people are going towards
That's
now.
kind of like the latest decision
Yes.
is to call it just pelvic girdle pain.
And I think that encompasses multiple sites of pain.
Yeah.
So pubic symphysis pain, so at the front, sacroiliac joint pain, which is at the back, but we definitely steer away from being like, yes, it's sacroiliac joint pain, because it's very, very hard to say for sure that is the place that is.
Have we talked about this? I don't know if it's really our target audience, what they care about, but I really care about it. So
We've
maybe-
definitely had this discussion
Yeah?
about how it's so small and that deviations are not actually...
Yeah.
I got a little tidbit of information here. So they have done studies on this. So you may have heard people say before, oh, my sacroiliac joint is upslipped or downslipped, or I don't know, whatever else they may say.
This way and turned that way and that. Yeah.
Yes. So the research is that you cannot displace your sacroiliac joint unless you have gone through some kind of a high speed, high velocity trauma. So car accident, motorbike accident, et cetera, et cetera. And what they did is, I don't know how
is
they
cool.
did this,
Yeah.
but they put ball bearings into people's sacroiliac joints. I have no idea how
I
you
know.
would do that.
I
but-
heard this for a podcast, so I don't
Yeah.
know exactly how either. But yes.
So they did that, and then they got
know.
physiotherapists to assess them and say whether they thought it was upslipped or downslipped or whatever. And then they took MRIs, I think it was, and it found that even if a physio had said they were upslipped or downslipped, the pelvis was not in any kind of abnormal alignment at all.
Yeah. So they went specific anatomical sites for these ball bearings, so you could take the guesswork of measuring out of it and just completely see this is the same spot in all these people and this is the same spot on both sides. And,
Yeah.
and
On the
see.
YouTube video, you're going to have to put another picture of
That's
the
fine.
sacroiliac joint.
That's fine.
Google it.
And it's wrapped in ligament,
Oh, yeah,
Like,
it is
it's covered.
stuck.
plus all the muscles. Yeah.
Yeah.
But people love to blame it.
Yeah, and I think, with any kind of condition or injury, you see asymmetries, and that is probably what the physio who was assessing them was pointing out. But I think where their mistake was is saying that it was because of the joint
Yeah, so
malalignment rather than differences in muscle length or muscle. Yeah.
If I may,
Yeah.
Abby recently had a sore knee. And no one looked at it like before, because who looks at normal knees?
Yeah.
And then she had a sore knee, and then when a few different people assessed her and whatever,
Yeah.
the sore knee moved around, the patella moved around more than the other side. So then you see that, and you kind of retrospectively go, oh well, then that's something.
But I think
And I
we
don't really
realised-
mean to pick into it too much, but just the fact that
Yeah, it's where does it come from? But we did actually realise this because I got my ITB band needled. So it probably increased
yeah.
the laxity.
Yeah.
So it was
Anyway,
able
I
to
didn't.
do a
But
little
the point
shift.
is, something happens, and we don't have a pre-picture. We
Yes.
only have the after picture, and then we try and make guesses as to what's gone on after
yeah,
the
and
fact, right?
sacroiliac joint is obviously something that's just kind of put out there as a reason.
Because
but you're kinda
mine
saying
has
not
hurt before.
necessarily.
It hurt before pregnancy twice. I had 2 flare-ups, and it's hurt just a couple of times during pregnancy. And my knowledge of anatomy, it feels like my sacroiliac joint. Like I can see it in my head. It's just off from my sacrum and it feels vertical. And I would tell you that it was my SIJ because that's exactly where it feels. And it feels like this.
Yeah.
And you feel wobbly.
Me too. I've had exactly the same thing where the pain, I could swear it's coming from that exact location. But what I guess people don't think about is that you've got your L5, S1 facet joint, which can refer pain right there. And it's very hard to kind of take a step back and be like, maybe the pain isn't coming from here because it really does feel
feels like it's...
Yeah.
I can see your pelvis in my head and that's exactly where my pain is.
And even when you, as a physio, people come in, sometimes they point exactly there, and then you have to take a step back and go, I know all this information about sacroiliac joints and it can't go out of a line, but that's exactly where they're pointing.
No, but I think that's good. Like you can still communicate that with a client. Hey, like this is my knowledge, but it doesn't necessarily mean your joint is slipped, because I think that's an important thing to tell a client, because as we talked about with that pain perception, if you picture like a joint in your pelvis being slipped, like I'm thinking like a seesaw tip to the side, you're going to be fixated on that, and that's going to affect like what you do, how you move, how you think about your capabilities. So I think that's important to be like, this is what I think, it looks like this, but your joint's actually okay. There's other reasons for it.
Yeah.
Because unless they come in with those words, my SIJ is slipped, I wouldn't even, well, I'm not in this area anyway, but I wouldn't even mention it.
No, and I often don't.
Yeah, just say, oh, you've got some pain here, let's help that.
Yeah.
You wouldn't label
Don't want
it.
to put any pictures in the head.
No.
Yeah, for sure.
Yes, that was a little bit of a sidetrack there.
Yeah, I was just
How
trying
did
to
we
wind
get
us
there?
back. Pelvic girdle pain.
Get us back on track.
And then I really wanted to talk about SIJ and how much of
Oh, yeah.
Oh,
how
couldn't help it.
ridiculous it
Yes.
is as a concept. And then move on from there.
Yeah.
Your SIJ cannot move.
Yes. So that brings me on to relaxin.
Yes, please.
Which is very interesting. And full transparency, I used to say probably a couple of years ago to my patients, when you are pregnant, you have the hormone relaxin going around. And like you said on the podcast last week, it makes your ligaments more lax so that your pelvis can get wider in preparation for birth. And this used to be what people thought caused pelvic girdle pain almost in isolation. So your ligaments get stretchier, your pelvis moves more, you get pelvic girdle pain. But the research now shows that the relaxin levels in the blood, and they've done proper research into this, they've taken the blood tests and found how much relaxin was in their blood. The amount of relaxin in the blood does not correlate with the levels of pelvic girdle pain.
Yeah.
So although relaxin is probably very likely to be a contributing factor, it's not the cause.
Because I was pretty happy with the thought that, like, if it made things move more, then that signal is going to be paid more attention to in the brain anyway. Like, we were only moving this much and now we're moving this much, and that's going to mean something. And that if that's perceived as threat, then that would be pain. And I was kind of happy, like, with that. But maybe even less so than that.
Yeah.
As far as
No,
contributing factor.
But I think as well, you got to think how many people get pelvic girdle pain outside of pregnancy. You know, so it is 100% more likely to happen during pregnancy. There's got to be something going on biologically to make you more likely to have pain.
And with that, relaxin's not the only change, right?
Yeah.
Like, if we talk about pregnancy and the changes.
The weight that you're holding, that's downward.
A huge one.
I've gone up 10 kilos in like 6 months, right? Like, that's a massive, that's a pretty decent increase in just what your body has to deal with.
Yeah. And a lot of the time, the pain that you're feeling is not from the ligaments. And I mean, you wouldn't be able to tell whether you have ligament pain or where the pain is coming from. But with your change in loading, whether that be from laxity or just a change in the way that you're loading, if your belly gets bigger and your center of mass is more towards your front, you're going to be using your body differently. So it's going to make your muscles sore. And a lot of the time that pain can come from, you know, muscle stiffness, muscle soreness, reduced mobility, a million different things that aren't purely related to laxity. So they're definitely steering away from that.
Narrative.
I have a question. Because with the whole relaxin thing, like the body's making hormonal changes to allow your pelvis to widen for preparation for birth.
Mm-hmm.
So another thing that I've heard is like minimize inner thigh work. So I'm thinking Pilates ball squeezes, and also be cautious of glute med, like banded abduction, because that can cause tightening or over strengthening of those muscles, which will interfere with the natural want/need of your body to widen.
So what I was first told
Shakes
exactly.
her head. I know.
What I was first told, which I have since unlearnt.
You've heard this too, right?
Yeah.
I'm not going mad.
I was taught this because the way it was explained, which makes sense, is that your inside thigh is attached to your pubic symphysis kind of thing, and then if they contract, then you're pulling it further apart.
That's exactly
which is already like sensitive. So why would you want to pull it further apart? So you're just not going to contract your inside thighs.
Yes.
And then same thing with like going out, like kicking a leg out to the side. You're kind of like biasing that pull apart motion. So why would you?
Yeah.
Why
so
would you do
I've
that?
been is a victim the right
Yeah,
word? Of the same. The same education.
Yeah.
That's probably not the best.
Yeah.
And I think the right word is caution, because the way that you think about it, it's not that you can't do it, but if you do have pain, it's something to be cautious of, because it could make the pain worse. So I don't think you can say doing inner thighs will give you pelvic girdle pain, so you absolutely cannot do it throughout pregnancy. I think it's a very limiting, thing to tell people.
Yeah.
But if they do have pelvic girdle pain and that particularly flares them up, maybe it's something to modify or avoid, rather than saying it's going to give you pelvic girdle pain.
I agree. Because that's what flared me up. I was like doing fine, feeling like pregnancy was not going to have any effect on me at all. And I was standing and I kicked like a heavy med ball at work or something. Like I kicked it across my body, and it was heavy, like 20 kilos or something. And I went, "Whoa!" And like I felt my inside thigh kind of go. And then it was a good 2 weeks after that where it was quite localized pain right on pubic symphysis. And then couldn't handle any single leg stuff.
Yeah.
But I had done something silly as like an event. And then it just took longer to go away because you have to walk. So I was like constantly on one leg anyway and just minimized everything else. But that was my like trigger event,
inciting
whatever.
So
yeah,
you're
exactly.
saying that it's not
But it
gonna,
was
like,
a silly move in the first place. Yeah, go on.
it's not going to make or break anything. Just listen to your body's cues in terms of if there is existing pain. If it's going to exacerbate the pain, stop and just don't do anything dumb.
Yep.
Like kick a 20-kilo med ball
Pretty much,
across
yeah.
your midline.
Yeah, while your body's rapidly changing. Yeah.
Cool.
I think,
Nice.
generally the attitude now in terms of exercise and pregnancy is just try not to tell anybody not to do anything. It creates further issues down the track if you're saying this is going to damage you or this is going to,
for sure.
cause this for sure. That's more damaging than letting them do the activity in the first place. I mean, there's definitely exceptions. Don't box jump. Don't do anything where you can have.
We
force
kind
do
of talked
something.
about this as well. Like, don't go scuba diving. Don't play
Don't
rugby.
skydive.
Like,
Yeah.
come
But
on.
otherwise, as long as it feels good.
Because things are scary enough already. Things are out of your control enough that you don't need to add your conscious thought into what's going on, which probably leads quite nicely into something you mentioned before we started
I
recording.
was just thinking that.
About a review you looked at about the
Management
biggest
of pelvic pain.
Yeah.
So that actually does lead on very nicely. So now they're steering away from more of the biomechanical view of pelvic pain, and this is not just in pregnancy.
I was just about to say this is a
General.
industry-wide
Yes.
shift.
And this study as well looked at pelvic pain in everybody, not just pregnant women.
Cool.
As well.
Cool.
And what were we talking about? Go on.
What makes you get better if you have pelvic girdle pain?
Yes. So
Without giving you the answer.
She just went to zoom off to another planet. What were we mid-sentence? What were we talking about?
I saw it leave your head.
I know, because I was thinking about something else, and I was like, oh no,
You're
it's gone,
three
it's
thoughts
gone.
ahead of where you were.
It was like biomechanics are
Yes.
Swung
Yeah.
It's all
Yeah.
come back to me. So we're steering away from a biomechanical view of pelvic pain and steering more towards a biopsychosocial perspective, and that is the big buzzword in the physio world and many worlds at the moment. It's that holistic view of treating someone with pain. So when you're looking at someone with pelvic pain, it's not just, in terms of pregnancy, it's not just the ligament laxity like we talked about before. It's biological factors, it's social factors, it's psychological factors as well, which then leads into not telling women that they can't do things, causing fear, causing catastrophization, all of that kind of thing. And then what I was saying to the girls before is that in this study, they found that the biggest predictor of a positive outcome in those with pelvic pain was whether they believed that they would get better, which is incredibly interesting.
Absolutely.
Over like relaxin levels in the blood.
Everything.
Yeah.
Over everything.
Yeah.
Exercise history, fatigue.
Yeah.
Weeks pregnant versus not pregnant or everything.
And that's we talked about that a lot. Episode 42, I was just having a scroll through our releases. We talked about that with Lee, like is pain all in my head, and how the perception of pain is very much not so much biomechanical. There's so many more factors to it.
Yeah. If you ignore the psychological factors, or any of them, which is why it's a 3 thing, but like if you ignore any bubble, you're missing so much of the picture.
Yeah, I'm doing a advanced pain management unit at the moment.
Amazing.
And it's very interesting, but there are times where I think this is so much. My brain cannot handle it.
Wow.
But
You're being asked as a clinician to look at every single factor of that person ever and tie it all together.
yeah. And just the evolving research in terms of pain and just Lorimer Moseley as a person is God.
That's amazing. I love him.
Yeah.
I emailed him to have him on the show. This was early days. I never got a reply.
Oh, rude.
I was listening to a podcast. He was on I think it was the British Journal of Sports Medicine
Of course
podcast.
he went on that
Oh, so
one.
they're a little more high
That's
end than
why
our
he's not
show.
on
No.
Ain't big, nothing
This
wrong with
pleb
that.
from Perth emailing, please be on my show.
But it was a very good podcast, and they had a medical student on the podcast talking about his education in medical school and how it was like 1 hour of medical school dedicated to pain.
Wow.
Yeah, and then I think the podcast was called, it was something about mislabeling nociception as pain, which again is a topic in itself, but very interesting. You have nociception, won't go into that, but pain and nociception are not the same thing. Pain is a subjective experience, which depends on a million different things. So very much the same with pelvic girdle pain.
Absolutely. Well, yeah, just from like my study, I started in physiotherapy school, and that's where I got a pretty decent pain management education. We had a whole unit from this really cool guy, Will Gibson. What was that his name? I hope that's his name. I'll edit it out if I've gotten that wrong. Lee will know. And then I transferred into just exercise science, and they didn't know any of that. And then I went on to my graduate diploma in exercise physiology, and we had one guest lecture, and it just didn't cover anything.
Yeah, and I think in my undergrad for physio, it was definitely by that point, 5-6 years ago, they were improving their education, and especially with Curtin University as well. I think they're very good with that.
Yeah.
But even this unit, I've done 1 week of it, and
That's
I think the
intense.
1 week was the whole semester of my undergrad.
Fair.
So
Okay, yeah.
it's going to be very enlightening.
Yeah, same. So my undergrad, probably about 5 years ago, but I was amazingly interested. So then I would go to the lecture, and he gave me extra textbooks and stuff. So maybe also that's impacting my... It was an amazing unit because I really got as much out of it as I can. And I'm not expecting... I don't think I know as much as your unit, but it was a pretty good
Yeah.
It's
ground
And I think
level.
evidence is always evolving. There's always new things to learn.
Yeah. It's like the same, I'm just thinking from a nutritional perspective. Like I started at a place where I'm thinking IBS, like abdominal pain and bloating was kind of like, there's digestive enzyme issues or increased gastric motility or lack of electrolytes, which cause spasms of the digestive tract. I don't know. But then where I ended up, they were very holistic. So it was like, let's look at why this pain is happening, stress levels, sleep,
Exactly.
all of that. And that's a perspective that I come from now. And like even just telling a client, you know, how's your stress levels been lately? Stress management is like number one, I think, for getting positive results with like IBS symptom management. Like it's number one, in my opinion. Like
I think most things.
Yeah.
I
It's crazy.
completely agree.
Almost
Yeah.
everything
But
would
it's
have a
just such a
component.
nice new perspective to look at it.
Yeah. Well, yeah, going back to your knee, if you don't mind me bringing it up.
Yeah, sure.
We had a really quick chat, so I'm only pulling off what we had in one conversation. But like, yeah, the answers you were given, in my opinion, were very biomechanical, and people like zoomed in on your knee or your hip and went, what's going on here? And then we were chatting and you'd gone for like 2 long runs back to back after not running for a while. Like,
Ding, ding, ding.
Yeah, right.
You know?
I know.
and people are like trying to look at your ITB and telling you to strengthen VMO and it's all this big, and really you're just like, well, don't do 2 runs back to back after not running for a while and you'll be sweet. You
And
know?
I know that too, which is why I was so mad about it. I was like, if someone else said that to me, like, I don't even have, because I was like, oh, maybe it's my pelvis because it's
Scoliosis. So of
Scoliosis.
course you're going to pull on and be
so I was
what's
like,
going on
that's
here.
why. And then someone was like, well, if I went for 2 long runs like that after not running for 3 months, my pelvis is fine, and I probably would have ended up with some issues.
Yeah.
And I was like,
And like your pelvis
point.
is like that all day, every day.
yeah.
Yeah.
That's
Wow.
not
Big picture, people.
Yeah. Zoom out and have a look. Same with pregnancy, right? Like, what's the ligament laxity? What's your weight gain? What's your center of gravity? Just like, how are you actually dealing? How's your sleep
Zoom out,
going?
look
Are
at the
you
big
stressing?
picture.
Yeah.
And like, I really like the correlation between improved pain and belief that you can get better, because you see a lot of people like that then become reliant on the kind of, you know, the band things.
Yeah, the
Oh,
belts.
geez, that
Yeah.
feels magical though.
Yeah, I'm sure it does. I'm sure it does. But then like, it's kind of like, I'm thinking about my back brace even, like, because that was like my protection, and I was only okay if I had that on, and when I took it off I was like, everything's wobbly, and I was like, not necessarily.
Yeah, it's when the attitude goes away from, oh, this is a relief, to I need this.
Yeah, dependence.
Yeah. Oh, geez, I'm all over, because, same, yeah. Netball players strap their ankles
Right?
every game,
Yes.
and then what
I am one of
happens
those.
when you
It's,
can't?
it's purely psychological.
Yeah.
So
Because I'm so afraid of spraining my ankle, because I know how awful it feels. I'm like, I'm just going to keep them strapped
But
every
what's
time.
rigid tape going to do against the
It helps the
forces
brain,
of your...
Shelby. Sometimes you
Helps
just
my
have to do it.
brain.
Yeah.
It's a psychological component of
And that's
it.
when
I
I
get
got,
it, but, you know.
When I got my knee strapped, I was so scared to tell you that I got my knee
I
strapped, because you
I
would
could
have gone
feel
off.
it when you were telling me, because I, like, saw it. And I was like, she hasn't told me about this yet. And
It's
even,
not
like, the type of strapping, and I was...
But I
Should
knew
they
that
get
was
a medial glide of her patella to help?
Sometimes it can give you
It
relief.
gave her relief, and that I was fine with that.
It did.
2
I
days,
was-
take it off.
Yeah.
That-
Yeah.
Yeah.
And
I
I was
knew that
fine
too.
with that. I'm never going to make you feel bad about something that makes you feel better. I was just a bit uncertain on the definition of why it helped.
I knew it was psychological.
Anyway, an hour into recording a pregnancy episode, we're talking about knee
Knee
strapping.
strapping. I like
Can't
this train
help
of thought though.
Was there any... Oh, actually, yeah, I quickly wanted to jump back to the ab separation.
Oh, yes. Okay.
So I'm pregnant, my abs are separated,
Yep.
I have my baby.
Yes.
Is it the biggest thing in the world? What's going to happen then? Is there
Ah.
correlation with pain after that?
This is good. Okay, so often tummy muscle separation is not correlated with pain. That's really, I think, a rare thing for people to complain of. The biggest,
Postpartum?
yes, even postpartum, it's
Cool.
not, I don't think the correlations with pain are huge at all. And
Right.
I've never heard, in my clinical experience,
Yeah.
someone complain of pain, either pregnant
In
or
abs?
postpartum.
Because I've heard it be related to lower back pain.
Maybe sometimes,
Yeah.
but again,
Our whole, just
Yeah.
listen to the last 20 minutes.
Yeah.
Yeah.
we won't go back into that. But what it is correlated with is self-esteem a lot of the time. So when you have tummy muscle separation, it can often give you, in inverted commas, like that jelly belly kind of feeling. So people feel not as comfortable in their aesthetics and also can feel vulnerable. So if they have a really big tummy muscle separation, it almost feels like there's nothing between the outside and the organs, and that can be quite a vulnerable feeling.
Yep.
And they're more the things that people complain of. It's not a huge deal if you have tummy muscle separation in pregnancy, but like what we touched on before, seeing a physio, if you do notice it, can help you modify things to avoid it getting worse. So everyone has a degree of separation, but you can definitely prevent it from getting too far separated, I guess we can say. So it's that doming and that coning repetitively that will often make it worse after you have bub.
Because that still happens after. Like, even if you don't have a baby there and you have separation, you will still dome intent.
Yeah.
And that, like we said, is just pointing to that lack of coordination. Like,
Does it go? It would go back to a certain degree, like directly after.
good point.
Would it?
Yes and no. So it depends on your degree of separation. So if you have a small separation, often it will go back to normal on its own without you needing to do much. But for some people, you know, they can get up to a 10 centimetre separation, which then...
It's as much as your cervix dilates.
Yeah,
right?
is a lot harder for it to come back together. So I don't think it is a routine thing in Australia, but I think it is very, very common for women to get tested for it on the ward. And if you are pregnant and are going to have a baby, I'd recommend that you ask to see a physio and to have them check you. Yeah. And then in general, I think it's the belief that everyone should have a 6-week postpartum check with a physio anyway, which is when they can check your tummy muscles and a whole bunch of other things.
I haven't prioritised, like, I haven't seen a physio yet, but that was my, like, non-negotiable. I'm going to come see you at 6 weeks.
Yeah.
Like, that was my, that's going to happen. And everything else I've been happy to kind of go, I'm happy with my knowledge to deal with this myself because of my background. But that was my one, like, no, I'm seeing Renee at 6 weeks.
I think that's a good idea. And then at that point, it would be about, you know, avoiding certain things that make you dome or cone, or modifying them so that you can do them properly, giving you targeted exercises to help the muscles come back together. And then in very, very rare cases, some people have surgery, but that is very rare. And you would try to manage it conservatively, like anything else, before you go down that route anyway. So it's not the end of the world, but if you do notice it, I guess like anything else, see a health professional and they can help you.
Is there like a time span which is like generally acceptable with going back to, you know, what you were prior to?
So do you mean in the terms of if you notice?
If you have separation, you're diagnosed with it and you are prescribed certain exercises, as a clinician, are you like, oh, we're looking to see improvements in this time, or is it very individual?
It's very individual.
Yeah.
I've heard that if it doesn't happen by a year, it's not going to happen. Is that anything?
It's big. That's a big statement.
Yeah, that's why I wanted to bring it up.
I think there is some degree of truth in that statement, but also not. I think you may be able to improve, but your chances are probably less than if it were earlier postpartum.
But does it have a functional impact anyway? Or is it purely the aesthetics? And
that's
obviously that might mean...
I mean, it probably does have a functional impact in that your abdominal muscles are important and they've lost their integrity.
Like mechanical advantage as well. Like they're in a different spot.
Yeah. And it would give you that feeling of vulnerability if you had a big separation and you don't have that protection of your tummy muscles. So it would probably be majority aesthetics, but also functional. I don't think it's good for anyone to have a huge separation between their stomach muscles.
Because right now, like I haven't measured it. Like you can during pregnancy measure it, can't you?
Yeah.
I've definitely domed before. But like the outwards pressure of baby is enough to like feel somewhat secure for me anyway. So I can only imagine when baby's not there and you don't have that like pressure anywhere.
It kind of gives you tone, doesn't it?
Yeah, absolutely. And I can still feel my belly. But if there wasn't that thing to press against, I doubt it would feel as secure as it does now.
Like a deflated balloon.
Yeah.
It's like blah, blah.
Yeah.
Sound effect.
Good sound effect. Because that's what people often say is jelly belly, or I feel floppy, or...
I can't feel them. Like they just can't find their abs from a sensation point of view.
Yeah.
Yeah. Cool.
Covered a lot.
Thanks. That's fun.
No, this is I've thoroughly enjoyed
I've
this
enjoyed
chat.
this.
The tangents, like, although they were tangents, they were good ones.
Yeah.
I believe.
I'm a bit overtired, so I'm going to blame my lack of like ability to hold everything in on that.
I'm gonna blame my curiosity,
Great.
my nerd brain.
And it's just been 4 months for Renee, so she's to just get everything out.
Yes, it's so good.
And yeah,
I've learnt so much in the past 4 months. My brain has been smushed with information. It's
Amazing.
so good to share.
It's going well
awesome.
though, your course.
Yeah, I love it.
Cool. Brilliant.
It's really
Nice.
good.
Brilliant. But just back into semester 2 now.
Yeah, last week was week 1, so week 2 at the moment.
Okay.
And apparently 48 hours of study a week plus working 20 to 24 hours. So
Because last we spoke, you were
Lord.
just about to start your new role as well, your new job. So I know a little bit, but how's it going?
it is going so well,
Cool.
actually.
Cool.
It's growing.
Yes.
So for those who didn't listen to the last episode, I am working at Dinella Family Medical Centre with the GPs there as their physio. So it's a great position to be in.
so cool.
So good.
Yeah, getting referrals from the GPs, now starting to extend a little bit out from the clinic and trying to get some more people from the community. My goal is to build up the pelvic health incontinence side of things, because in Dinella, for those who live in Perth, there's not a lot of pelvic health physiotherapy available around that area. It's definitely a bit more of a niche and is more available in certain areas, and that's not one of them. So I want to bring it to the local community, make it more accessible.
Mm-hmm. Hey everyone, this is Shelby. That right there is exactly where I ran out of space on my recording device, and we didn't get to do a proper ending to this episode, but pretty much we go on to say that Renee's really excited to bring more of the accessibility of pelvic health physio to the people of Perth, and how we were obviously quite encouraging of that fact. Thanks so much for listening to this episode. It was really, really fun to talk to Renee. She's obviously very educated in this area, which was really fun for Abbey and I to talk about. So thank you for listening. We will bring another one out in about a fortnight. If you want to check out more, you can go to turnsounds.com and plug it in, and you can support the show from there and get some extra content, or just check us out on Instagram, moveyourmind.podcast, and have a check out what we're doing. Excellent. Have a great day. Thanks.